Do you have us? Am I ready? Hi, welcome. Hello, everyone. Welcome to Partners First Community Cafe Forum. We're so glad you have chosen to spend the next hour with us discussing Medicaid reform or Medicaid transformation. So let us go ahead and get started. First, let me say, while you can see us, we cannot see you. We, the panel members, cannot see or hear you. We have temporarily muted you. So while we go over the material in the PowerPoint, but you are welcome to ask questions. If you would, please put them through the chat feature that you have on your screen, and we will periodically stop and check to read the questions within the chat and answer those questions. Once the PowerPoint has concluded, we will turn on the video feature and allow the microphone and video camera to be utilized so everyone can access camera and voice feature so we can have an open dialogue. Let me get started with introducing our panel members. My name is Tara Conrad. I am the Director of Community Operations here at Partners, and I will introduce our panel members, starting with Katie Varnado, or actually I'll let her introduce herself. Katie?
I'm Katie Varnado. I'm the Regional Director for Catawba, Burke, and Rutherford.
Andrew? I'm not sure.
Good morning. I'm sorry, my computer just shut off, but I'm calling in, and this is Andrew Schrog, and I am the Regional Director for Gaston, Cleveland, and Lincoln counties.
Jeff? Jeff? Oh, we lost Jeff. We'll go on to Jamie Piercy.
Hey, good morning. My name is Jamie Piercy, and I am the Community Engagement Specialist for Burke, Cleveland, and Rutherford counties.
We have Jeffrey back. So Jeff, do you want to introduce yourself?
Yes, I'm Jeff Eads, and I'm the Regional Director of Community Operations for the Northern Region, which is Surrey, Yadkin, and Iredell counties. Good morning.
Thank you. And Abby Cole.
My name is Abby Cole. I work in the Marketing and Communications Department at Partners as a project manager.
And you've been introduced to our panel members for today. And as stated earlier, this is our Community Cafe debut. Our goal is to provide information to our community stakeholders. So we want to provide you with current and upcoming information relevant to our stakeholders within the 9 counties that Partners covers. We want to engage in an open dialogue about pending changes of member and community needs and other areas of concern for you, our stakeholder. We want to promote a respectful platform where all voices are heard and a robust exchange of ideas can occur. So Abby, can we proceed with the PowerPoint, please? And if we can go to slide number 3. So this is meant to be an introductory discussion on Medicaid transformation. It will not provide you with all of the rules and requirements necessary to fully comprehend or implement all aspects of the new law, but it will give you a basic overview so you will have a general understanding of what it means for the members you serve and where you can direct them to go to obtain additional information. What you see on the screen now is a poll. We want to know whether you have heard of Medicaid transformation before today. We're trying to gauge the level of understanding on this topic. So if you will, please respond to the poll with a yes or no if you've heard of Medicaid transformation before today.
Sorry, Tara, that I'm gonna reshare. I had the wrong view up.
We thank you for your patience.
Let's see.
You have to love technology. It's so much easier to do this in person.
I'll go ahead and tell you the poll results. Can you see that, Tara?
We cannot see the results of the poll. I'm hoping you can, Abby.
Yes, so out of 55 people, we're at 98% yes, they have heard Medicaid transformation before today, and 2% no.
Okay, good.
Okay, let me try this one more time. I'm sorry. Okay.
I will tell the audience, it is very hard to talk without seeing your faces, just so you know, especially when you're a people person and not being able to look at you if I'm talking to you.
Okay, I think.
So Abby, if we can go to the next slide, please. So what's changing? North Carolina is making changes to how Medicaid is managed in all 100 counties. Today, we're briefly going to touch on standard plans, tailored plans, the tribal option, and statewide foster care plan. So most individuals receiving Medicaid will get their services from a prepaid health insurance plan that they choose. This is called managed care, also referred to as a standard plan. Medicare or managed care is not new to North Carolina. Since 2005, North Carolina has operated under managed care system for specific mental health, intellectual and developmental disabilities, and substance use services. The program started as a pilot program in the Piedmont region and went statewide in 2013, for those of you that have been around for a while. Managed care for behavioral health services is currently operated by public local managing entities and managed care organizations called MCOs. Partners Health Management is the identified LME managed care organization for Burke, Catawba, Rutherford, Gaston, Cleveland, Lincoln, Surrey, Yadkin, and Iredell counties. Some individuals will continue to receive behavioral health and intellectual developmental services from the LME MCOs and will receive medical services through the current fee-for-service model, which is North Carolina Medicaid Direct, until July 1st of 2022. Then tailored plans will become operational. So please rate the level of understanding of North Carolina's Medicaid transformation. So we'll pause here and take this quick survey.
All right, and there are the results. We have the
Abby?
members that say they have some understanding, 67%.
Thank you. If you could close out the survey, but stay on this slide. So beginning in July of 2021, the state will expand on managed care for Medicaid and North Carolina Health Choice recipients. Behavioral health, physical health, and pharmacy services will be managed under a managed care system through prepaid health insurance plans called PHPs. This means that individuals who receive North Carolina Medicaid and Health Choice will receive services through a provider that has entered into a contract with the state to deliver services, medical, behavioral health, and pharmacy services. These services will be authorized and monitored through the PHP, much like those under private plans, like many of you have, such as Blue Cross, Blue Shield, Aetna, etc. Those will be the standard plans. In July 1st of 2022, the tailored plans become operational. We'll talk about those a little more in detail throughout the presentation. Next slide. So take a minute to answer this survey question, please. What do you think is the primary reason for moving forward with managed care? Well, you guys were correct. Better outcomes for individuals. The legislative, yes. Yes. Thank you, Abby. If you'll stay on that slide, please. So why make the changes? Well, part of it was due to the legislative mandate and to achieve better outcomes for individuals and cost savings, of course. The DHH vision is improving the health and well-being of all North Carolinians through the innovative, whole person centered and well-coordinated system of care that addresses both the medical and non-medical drivers of health. Individuals will have one health plan for most health services, including physical health, behavioral health, and pharmacy. Medicaid eligibility rules are not changing, and all plans are to offer the same basic benefits, such as the office visits, blood work, etc. Next slide, please. So who qualifies for the standard plan? Most Medicaid and Health Choice beneficiaries, including those with mild to moderate behavioral health needs. So when you think about this, you'll think about individuals that may be able to be treated by their family doctor or their pediatrician. It would be those with the mild to moderate depression or anxiety or ADHD, those with the mild behavioral health needs. Some populations are exempt from the standard plan and some are temporarily excluded. Your federally recognized tribes, like your Eastern Band of Cherokee Indians, are exempt from Medicaid managed care standard plans. There are several populations that are temporarily excluded, Some of these include those who reside in a nursing facility and have so resided or likely to reside for 90 days or longer, or not being served through the CAP DA, beneficiaries residing in veterans homes operated by the Department of Military and Veterans Affairs, and several others. I encourage you to reach out to your local Department of Social Services or the enrollment broker for a full list of exclusions and temporarily excluded members. Next slide, please. So there is a very comprehensive list of services under the standard plan. This is just a very tiny glimpse of what is available. There's physical health, behavioral health, pharmacy, long-term services and supports, services and supports that address other unmet health-related resource needs. Next slide, please. Standard plan options. You have several options under the standard plan. One is a provider-led entity, Carolina Complete Health, for those beneficiaries that live in regions 3, 4, and 5. For those counties that are served by partners in region 3, we have Catawba, Cleveland, Gaston, Iredell, Lincoln. They will have 5 options to choose from. Statewide prepaid health plans, you have AmeriHealth, Blue Cross Blue Shield, United Healthcare, and WellCare. Next slide. The timeline for standard plans. Members started receiving information in the mail on March 15th. The open enrollment process began. May 14th, the auto enrollment started or will start. July 1st, 2021, standard plans go live. Next slide. Tailored plan members. Some members will stay in North Carolina Direct and will transition into tailored plans July of 2022. These will be members that are Medicaid, or those members that are uninsured or receiving state-funded services, adults or children that require high-level or ongoing specialized care. These are individuals with your severe and persistent behavioral health needs. You'll see on the screens examples of diagnoses that would fall within this category. That's not all of the individuals that would fall in the category, but that gives you an idea of some of the individuals that would meet the criteria. We'll take a minute to answer this particular survey question. True or false? All right. Everyone was correct. That was good. So there's, you can only get state funded services and B3 services within the LME and MCOs once Tailored Plan becomes live, or actually now. So populations excluded from managed care, including Tailored Plan beneficiaries who are enrolled in both Medicare and Medicaid, for whom Medicaid coverage is limited. The coverage of Medicare premiums and cost sharing, inmates of prisons, beneficiaries covered through or served through CAP C, CAP DA, and several more. Again, I encourage you to contact the enrollment broker with questions. the next slide, please. Oh, services. No, you were right, Abby. I'm sorry. You were correct. So on the screen, you'll see, again, this is a very short list of services available within the tailored plan. It will cover services available in standard plan, but also other services. It will cover behavioral health, physical health, pharmacy services, services and supports that address other unmet health-related needs. Services in the standard plan plus 1915C innovation and TBI waiver services. Next slide. The timeline for tailored plan, February 2nd, the applications for RFA to apply to be tailored plan were due into the state. The current LME MCOs were the only ones that could apply to become tailored plans. Those applications were due February 2nd. June 11th, the state will announce the awards for the tailored plan. And on July 1st of 2022, the tailored plans are to go live in North Carolina. There will be 5 to 7 contracts awarded. And if you would take a minute to answer this survey, please. Oh, good, we have a mix. About half will serve both, and about a third standard and about a third tailored plan. That's excellent. Jamie, I didn't think to ask, have we received any questions in the chat thus far?
We have not yet, Tara.
Okay, great, thank you. We will proceed on then with talking a little bit about the travel option. So Department of Health and Human Services is working with the Eastern Band of Cherokee Indians to develop a travel option to go live in 5 counties, Brown, Haywood, Spain, Cherokee, and Jackson, in Region 1, that are live July 1st of 2021. In accordance with station law, as its tribes, including members of the Eastern Band of Cherokee Indians, are exempt from mandatory enrollment and managed care. They can choose enrollment in a service or managed care to enroll. However, for federally recognized tribal members and other individuals eligible to receive Indian health services, travel options, if they have the option to opt out of the travel option if they live in the 5 counties and participate in either standard or tailored plan or in the Medicaid directed exercise. Tailored plans are required to establish partnership with the state and federally recognized tribes within the service area they serve, and implement the engagement strategy work with our state and federal recognized tribes within our 9 counties. Within tailored plans, Medicaid members of state recognized tribes are enrolled in Medicaid managed care populations. In partner service area, we have a little over 3,000 total tribal members, with an estimated 200 or less being eligible for tailored plans. So we have a very strong with those members and working with the tribal leadership on an engagement strategy to make sure we meet the needs of those members.
Okay. We will also substance abuse consumers use tailored plan or only the higher risk. So it's 2-part questions. I don't know if you want to start with that or read the whole thing.
That's a good question.
Yes.
So I don't know, yes, the panel members, one of the panel members wants to take a question. We grab it.
Yeah, for pet services, which is here, outpatient services, in some regions, like in the more tender substance use, support services, area, or something on where there's a term, application services, and then you find under same plan. So hopefully that helps a little bit on that one.
And unless they're indigent, they require $8 will follow.
Does that questions include the deficiencies, substance abuse agents?
No, we look at treatment needs.
I can do this example example.
I'll take that one, right? The figure on the evidence by this, or what for now here, research on that needs, we're going to use some why not when you enroll in a tailored plan? And if you can purchase on, it would be very cool because they certainly have options where they could opt to a standard plan. However, there are going to be services, bigger services, state-funded services, as mentioned earlier, that the person on, if they got onto the tailored plan, the person telling white they receive and they not be able to use those services. They just like opting staying from the tailored X. That's why one which is the gap between the same thing go out, that is why one tailored thing go out following the following things. So it's very important for folks on that was having regular routine conversations with your manager and ideas with partners to make sure that they understand fully that the choices within the same order planning is during the transition months. We manage that.
Yeah.
Next question is, what if I'm working with a child now? What do I do?
I'm sorry, you can have Jamie.
What if I'm working with a child?
I will tell the foster care next. Actually, that's next slide. Is that your question? Thank you. And we'll get to the rest of the questions. So the state by Foster Department of Health and Human Services is designing a specially dedicated plan to meet the needs of children currently and formerly involved in child welfare. It will be a statewide plan. The anticipated rollout date is July of 2023. It was scheduled to roll out at the same time tailored plans were scheduled to roll out. However, the state recently put some brakes on that and moved the date to July of 2023. The concept would be that children would have, and similar to the tailored plan, but they would have access to assessments and be able to move from one location to another with very little discussion in it or their need for services, etc. They should have quick access to whatever it is they need. It would provide continuity of care and coordination during transitions. And as I said, that has been published in July of 2023. So a lot of those children will fall in the tailored plan, however, some will remain within the standard plan. So I encourage the individual to ask the question you just raised, Jamie, to contact DSS and the enrollment broker and determine which plan that individual child would go, standard or tailored.
I want to take a little bit there. So the one for currently in some states, we have providers and people that have to foster. So right now, the state is the overall foster plan because they are wanting to really focus on care coordination piece. Knowing that foster care is really access to the need. So if you want to immediately so that there's easier to start that and help develop plans that we roll out in 2023.
Next slide, please. So community expectations for our stakeholders is to listen to individuals accessing their service. But we have to refer individuals to benefit to seek additional information. Refer to the local department of social services to determine eligibility for benefits. If they have Medicaid or health source, refer to the enrollment broker, this access. If they need treatment, call partners. The number posted there. Next slide. Your additional resources there. Next slide. The enrollment broker information website. More information on Medicaid, Medicare, design policies, and systems. And I think that's the end of the PowerPoint, Abby. And I think it's your last. It's going to be how many members first we have in the plan, like we have 29,000 Medicaid in state. All that is less than what we currently have. Those will be more severe individuals. All right, so we have increased understanding on Medicaid information. Thank you guys for participating in the survey. Survey questions. So we have, I think Abby has turned on the ability to use your camera and microphones. You're still free to use that chat box if you like.
I'm sorry, there's several more questions. You want to go ahead and go through those?
Please, I'm going to open it up to the panel members to ask or to answer too.
Okay. I think that a lot of families are confused about the difference between tailored plans and PAPC and PAPDA being carved out for a while and paying fee for service inside of their PAPC and PAPDA land under what umbrella?
That is a very good question. I believe, I don't know if a panel member wants to grab that one. I would be afraid I would give you incorrect information, so let me get back to you on that, or we will post it in our FAQ responses. I would be afraid to misquote information, but I also want to emphasize we do have a partners member cafe, and I believe that would be better equipped to answer the member specific questions. That is hosted by our member engagement specialist, and they have all details as they relate to member issues and member questions. Our department deals with community and community stakeholders. But I will be glad to ask that question and make sure the answer gets subject.
The next question is, will the transition to the tailored plan for an IDP client mean the person will need to change medical providers?
I'm sorry, could you repeat the question?
Yes. Will transition to the tailored plan for an IDP client mean the person will need to change medical providers?
So looking at the family, we're answer all the questions, but not necessarily no. If as long as a medical provider contracts with the tailored plan, which most if not all will, they're currently working with us.
So our next question is, what do I do if I'm working with a Native American?
Sorry, to jump in and get this one. But I mentioned in your presentation, that really is targeted towards those jurisdictions in the county. I mentioned I found that there's additional where people who are associated with these entities and participating in the county ground conventions. So this is an area I'm going to see the home part and look at their options. Because we can't just counties be able to participate in it. They're also available for people to participate in things as well. Or they need to in things that certainly that's an option that they have tended already with, and they're already also working in health services. The broker certainly help them walk through the pros and cons of various options.
Okay, so the next question is, I work at a local shelter. How do I go about being someone connected to benefits versus see if they qualify for a standard or tailored plan?
Probably not. Yeah, if a person, if you're one individual and question about maybe a shelter, it comes up quite a bit where the person where they may be eligible for Medicaid and just they don't know that they are, and so they can gain access to a lot more benefits. Sorry, I mentioned earlier in the presentation, there's several different options. One is if the person does not have any type of insurance coverage at all, one of the things that we can do is you can refer them back to our Access to Care, or we call the HOPE line, that 1-888-235-4673 number. And of course, they would do some screening to see if their person's need may qualify them for state-funded services. It may be also good to link them back to the local Department of Social Services to determine whether or not they would be eligible for Medicaid. And then the third thing would be if they have Medicaid benefit and they have a card with them, it would be wonderful to go ahead and do what Andrew mentioned earlier in the question that was around the tribal options, and that is to link them back to that contracted enrollment broker, which is called Maximus. And then again, they can help them and listen to the scenario and walk them through that and help them make a choice with it. So really there's three paths. There's partners, there's Department of Social Services, and there's the enrollment broker. And that can be quite confusing at times. So my default, if you don't know which way to turn, is the partner's toll-free number, which is staffed 24/7. And then there will be someone there to listen and help direct that person. So if all else fails, I would default back to the partner's line. So, thank you. That's a great question.
I just want to point out to the group that Jamie typed that number into the chat, so makes it easy for folks to jot down. Also, feel free to turn on your mic or your camera if you'd like to ask a question.
And I will add on to the question about IDD and needing discharge. There also is a fourth factor in Medicaid transformation, and that's the advocacy services that offer through NC Legal Aid and Vista Legal Services. So this service that the state has contracted out is meant to be an advocacy organization for our members and for the people that we're trying to serve. So if it's a third party, and if there's something that is going awry with the tailored plan or standard plan membership, then this legal service can help advocate for that and help get them on the path that they need to be on and in the services that they need to be in. And that includes if they need to change a provider or if they need to change plans altogether. So and they have some information on NC Legal Aid as well as the DHHS website about that.
I encourage everyone to check out the websites. And as I said in the beginning, this is just an introductory course or an overview. There is a wealth of information out there. Well, every day to give you all the information you need regarding the transformation. I encourage you to check out the websites, DHHS website, as well as the enrollment broker. And I encourage you to check out the member cafe for those that are member specific and have specific questions, as well as our provider network trainings. They are also offering information on Medicaid transformation. Review that information and continue to engage with other community resources on this topic. I know throughout our 9 counties, you will start to see quite a few trainings related to Medicaid transformation. This is just one of several trainings we will be hosting.
All right, there's a couple more in the chat. Do you want me to go ahead and go on with those?
Please.
Okay. One is, did you say that uninsured or IPRS may be in the tailored plan?
It will be in this.
Okay.
I don't think they need to fill out a waiver. They would follow specific things that make them qualify to fall under Medicaid direct. I'm not sure.
Okay. Target all. So they'll all be under the tailored plan.
All enhanced services that I can think of are in the tailored plan. But
Yeah, we were a little bit worried, but as a primary difference between tailored plan and tailored plan. So at this point, the services that we and services would fall under tailored plan.
yeah, I can't think of that.
I think that's all for questions. There's a couple more things in the chat. Kate in the chat box to request to join the state foster care work group. Send an email to medicaid.ncengagement@dhhs.nc.gov. So if anybody needs that, that is in the chat. And that is all.
Our thing before we end our presentation.
Sure.
And I just really wanted to again stress the point that the open enrollment period, Tara pointed out on one of the slides, opens up on the middle of March 15th, and that's going to run through May the 15th. And it's really important for folks to understand that during this time, if they do statements that's going to be in a standard plan, and they do not choose one of the providers, if the time goes beyond May 15th and they had not made a selection, and there's an algorithm, there will be an automated choice-making system that will go into play, and one will be selected for them. Now later they could go through a process of making a change to select one for them. So I'm just bringing that up because I highly encourage people not to let that day slip up on them, because I think we'll be here before we know it. And it would really be good if people could go ahead and exercise their choice about which plan they want to select. So I just want to reinforce that, Tara.
Okay. I am reading, thank you for that. I am reading the question about the waiver and Medicaid Direct. I have not heard that information that came in on the Q&A. I will ask that question and we will post the answer to that. I have not heard that you need to fill out a waiver, so we will follow up on that. Thank you for asking that question.
Part of the member engagement specialist need. In the chat box, member cafes are the second Tuesday of each month, 1 to 2 p.m. And registration is on the partner's public calendar. So the next cafe will be on April 13th.
Thank you, Beth. I didn't make note of that, but failed to mention it, so thank you for putting it in the chat, Beth. And Kate, do you want to mention our next community cafe and the topic I think you're hosting our next one?
Yes, Dean Patterson and I will be hosting our next community cafe at the end of April, and we're going to talk about some legislative topics that help priorities and outcomes in legislation. So I'm going to put my email address in the chat box, and if you guys